it's Nikki, Doctor of Physical Therapy at Greencastle Physical Therapy. I'm here with my assistant, Kelsey. We are going to go over an exercise that's kind of designed to work some of the deeper muscles in the low back to help with posture and some pain that maybe we are experiencing in the back. I'm going to have her turn and face that way so we can get a good side view here. The first step of this one is to sit into a little bit of a mini squat. So as we do that, we want our feet about hip width apart. Make sure our knees aren't buckling in. So we want to keep a pull out of those knees to really allow those glutes to get a little bit more active, give us a good stable foundation. And then we want to make sure we're sitting back into the sits bones. We don't want to round the low back and sit into the spine. That's not going to feel very good long term. So as we do this, we just want to have a good setup. So really tilting that pelvis forward, sitting back into those sit bones, into those glutes. Again, our pelvis is helping set up the foundation to move forward in this exercise. Our low back and our hips work very closely together, so we're going to try and utilize both of them to get these muscles to work. The muscle group we're aiming for, I'm going to make the legs burn a little bit, is right close to the spine, right at the belt line, kind of the low back here. And so to get them to engage, we'll keep those shoulders in lifted. She has nice, good posture in the upper body here. We don't want those shoulders rounded forward, because again, that puts a little bit more stress. Pull those shoulders back, a nice little lift here. We'll pull in the low belly, engage the waist, just so our spine, now our core is ready to work here. We're gonna lift one arm at a time. As we lift that arm, what it does is it increases the force that we're asking these muscles to work. Sometimes initially just getting into this position can ask these muscles to work if they're very weak. We have to have good core initially to get them safe going forward. And then we'll alternate one arm at a time. And again, the way this one works is that as that hand gets farther away, now the weight of that hand is increasing the load, really isolated in the back. If you're sitting up too tall, so I'm gonna sit up a little taller, so just kind of inch your knees here. If you're sitting up too tall, no, taller. Oh, it's hard to do. If you're sitting up too tall, the back actually is not working as hard because it's not set up appropriately. So that tilt forward, that leaning just a little bit forward, now we're asking those muscles to get a little bit of a load, to work a little bit. You can add weights as you get better at this. Don't go too far too fast because it can be painful if it's not progressed appropriately. And then to make it a little more challenging, you're feeling comfortable with it, you can try and do both at one time. Don't jump directly to this one. You can get a little bit of discomfort if we overwhelm the ability of those muscles to work. When you've had chronic low back pain or low back pain at all, a lot of times these muscles just naturally get fairly weak. So they get atrophied, they are easily challenged when they're placed in positions where they're asked to work pretty hard. Repetition-wise, you can do 2 sets of 10. Always start less, so maybe just start with 10 at a time. Positioning is key here. Use a mirror to help you set up at home. And if you're unable to get into a good position, just come see one of us. We'll try and see if there's maybe any deficits that are involved that are making it hard to even get into that position, but can be very good if done appropriately to really work some of those deep muscles in the low back.